I thought I would start out with telling everyone a little bit about myself. This is me in the 90s. I had a mullet. I was still learning how to properly discipline dogs, as you can see with the dog here, and loving my little baby sister who's there in the red dress on the right. While actively participating in Girl Scouts, most of those badges were from selling cookies. And all of this was really, the experimentation with hairstyles, the love of the outdoors, practice getting in front of others. It was really in preparation to be like, let's see, to be like, I can get this right, there we go. Jewel. She was just so cool. She was so calm, so talented, so fierce. And she was from the great last frontier of Alaska. I was from Missouri, and I remember learning about Alaska and just being in such awe. And but what I didn't know at the time was that Jewel had a father who struggled with alcohol. He had served in Vietnam and had used alcohol as a way to cope with some untreated PTSD. And as a young girl, Jewel would, tour around Alaska, and she would do these 5-hour-long sets with her father. And during that time, she was able to see kind of people and their use of alcohol. And she remembers, she talks about later as an adult, how for her, it just felt like she was watching people in pain. She ended up running away when she was 15 to escape abuse and then some others, and then also some behaviors that the alcohol brought on. And Jewel is not alone. Depending, Recover Alaska did a poll in 2018, and depending on the region, between 63 to 74% of Alaskans have been negatively affected by someone else's drinking. And since the 90s, like Jewel, like many other Alaskas, and likely many on this call today, we have journeyed ourselves or with those we care about on paths to recovery. That picture before that I showed of me in the 90s and my sweet little baby sister, she had experienced some of her own traumas, and she had started misusing alcohol when she was a teenager and heroin about 12 years ago. And so as we know, as we get older, there's different twists and turns that our life takes us. And spoiler alert, I didn't become a professional singer. Like you could probably imagine from my voice, I sing like how I talk. And so that really wasn't in the cards, but I was able to make it to Alaska in 2017. And since then have had the privilege to journey with Alaskans on paths to recovery. As a behavioral health clinician, a domestic violence sexual assault program manager, rehousing advocate, and starting in June 2021 with Recover Alaska as the Access to Care program manager. In a little bit, I put some information about our vision, our mission. I have our website on here. It's a really awesome organization. We work under Sultana, which is under the 4-Acre Group, and basically many different awesome folks across the state: Rasmussen Foundation, Alaska Mental Health Trust Authority, Mat-Su Health Foundation, Providence, UAA, DHSS, South Central Foundation, and many more really came together and to try to figure out how can we work together to figure out how everyone can work together to reduce excess alcohol usage and harm so that Alaskans can live free from the consequence of alcohol misuse. So I work alongside Tiffany Hall, our executive director, and Jeff Limburg, who does a lot of prevention work with the Alliance. And we work on different things around advocacy, social norms, prevention, and with my position, access to care. And so, like I said, I came in June 2021, and kind of in the heart of the pandemic, and maybe as you witnessed in your own personal lives with others, with those you serve, we did see an increase in alcohol consumption across the nation. These statistics are nationwide. However, with our alcohol sales, and this was at the end of 2020 that this was taken. But as we saw with alcohol sales in Alaska, that we certainly align these statistics. So when I came on in June 2021 to look at access to care, I had these different questions. Recover Alaska had already done a lot of great work in access to care with pilot programs, with research projects, just working with partners across the state, with different resource center initiatives that they had with 211. And so I was able to look at that information and then also get to talk with many providers, people with lived experience, people who are direct service providers. And I was looking at these three different questions. What does care mean? When people are struggling with alcohol usage, what does it mean to reach out to care? What options for care were available to people across the entire state? And what does it mean to engage in those options? And so from that, three things came up. And one, there's five core issues that kind of arose for people who are accessing care. And that had to do with accessibility. So to be able to actually connect with that, if it's either get to a location or access something on the phone, something like that. Anonymity, wanting to know, concerns about when they were speaking to somebody, what the privacy was. Readiness, what level people were at with addressing some struggles they were having with alcohol. Immediacy, people wanting to get that support and care as soon as possible, and capacity. And that had to do with, the availability of people to provide support. Kind of goes along with workforce and some of the struggles I'm sure many on this phone call have seen within their own organizations with being able to provide the different services due to capacity. So, so along with that, when talking with different people, another kind of thing kind of popped up that I thought was interesting. Looking here on the left here under stages of change, this was a model that was developed to understand how change happened, and change happens for people because change is hard. And so it kind of looks at it, the stages of change that people go through when making changes in their life, including reducing or abstaining completely from alcohol use. And so one of the things that came up in a lot of the conversations were that many people were identifying the options of being for people who are in the action phase instead of pre-contemplation or, before they even realized there was an issue, contemplation, preparation. There were some more people in preparation, maintenance, and then or in return to use. When people, sometimes you've maybe heard of relapse, and I think it even has that mentioned in this model here, but return to use, I think, feels more accurate for people and something people prefer. But anyway, so that came up. And then another thing is how people define care. And so a lot of people define care as treatment options within behavioral health settings. And so I thought that was really interesting when thinking of how Recover Alaska can support, different initiatives across the state. One of the things to look at is to look at where some of the gaps are, where people might be in a different stage of change than action. Looking at these 5 core issues and also thinking of what are some other options for care. It was really interesting when, if you ever have listened to Jewel, one of the things that she had developed is she had identified when she was young that when she was needing support, that she really relied on mindfulness practices. She read a lot about Buddha, used music, and had other different tools that she was able to use without supporting a formalized type of care. And so she actually made a toolkit later in life that's really cool if you ever want to look it up. But I was thinking, for the biggest thing to supporting people is providing options. And so looking at how Recover Alaska can support the different options and treatment, typical treatment options. What became really cool is on one of my first days, I learned about Health Tie. I was not familiar with Health Tie, and one of the programs that I learned that we were involved with is called Step Away. And I got to meet with Jacqueline, which was awesome. And I always joke, I was when I first heard about, I love Shark Tank. And to me, like Health Tie was kind of like Shark Tank, and just this really cool opportunity to look at how innovation and how creating different options for people can lead to wellness and different paths to those places of wellness. And so I started almost on day one. I talked with Tiffany and learned about our partnership with Step Away. And it was really cool because as I was having these conversations, talking to providers, looking at these different trends that we just kind of spoke about, it was cool that Step Away really addressed all these different things. You know, it's this app that people can get on and, you know, get immediate support, have that anonymity, have that access. You know, I mean, it does require, you know, to have a smartphone. But we do know a lot of people do have smartphones across the state and are able to access apps and really speak to different levels of readiness and what it looks like for recovery as well. So, you know, for some of the treatment programs, they're mostly for if people want to be sober. But for some people, they would like to take more of like a harms reduction approach. And, you know, especially with some of the inpatient treatments, that's not always available. And so it was really cool that looking at this Step Away, that this could be a resource that people could use. It was, you know, and Patrick and his team, I think Marco is on here, really did a lot of research and made sure that this was an evidence-based support to really help people engage with care as soon as possible. And so here's some about the Step Away app, and Patrick and his team are definitely more apt to talk about all the cool things about it. And I really encourage, if you have had the opportunity to listen to Patrick and his team or to connect with them, that it's great. I always learn something and get excited, and it's really cool that this is happening. You know, Patrick Dulin, who works here, he works here at UAA, and you know, we're really lucky to have an Alaskan working on a project like this. But and they've worked on this for, I believe, and correct me if I'm wrong for those on here, 10 years, and really have made sure, and they're constantly working on improvements and figuring out how to partner with different people. And I know, speaking from our experience, in my experience in these last 6 months, it's been really exciting to be a part of. And I put in, here's some of the information about it. And in the next slide, I also have the website if people want to, you know, take a deeper look into it. But yeah, it's just this really cool app that we've been able to be a part of. And with the partnership, we've developed cards that we've been distributing. Here's an example of like what the little cards are that we've been handing out. And it's just real basic information, super easy to use. And it kind of just gives, you know, shows how simple it is to really just get on it and start accessing it. Recover Alaska offers a free access code. So if it is something that people are interested in, to definitely let me know about that. And I guess that gets to my next slide here. Was for Jacqueline, when she asked me to do this, she's like, you know, think about what your ask is. And I really appreciated this and appreciate everybody's time, because I mean, the ask is to get this into everybody's hands. Like, if it means looking yourself, you know, at like, where are you at? And maybe it's not too, like I said earlier, for some people, they have different goals and different things they'd like to work on. Right now is dry January. So people who sometimes people are sober curious. Some people are just wondering maybe where they're at, or maybe wanting to get to be at a little lower level of usage. You can use the app for that. If there's somebody you know, or work with or serve, you know, it's to share the app, and then also to report back on the app. Patrick is awesome. Patrick and his team are awesome on considering feedback and just thinking about how to make it better and better. So that's really exciting. So I put some of my information here. All right. Well, you can email info@Recover Alaska. And then also, if you want cards, feel free to reach out to me. working with Patrick on doing like a letter to send with it to help explain what it is. So also, if you know of anywhere else that we could send it to, or have any ideas for getting the word out about it, please let me know. And this all kind of goes back to how recovery is possible. I wanted to end, as I had shared earlier, Jewel, she had this difficult experience, and I had my own difficult experience with my sister and other people that I've loved. And Jewel now, her father, he is now sober, and she has reconnected with him, and here's them singing together. And here's on the right is actually a picture of my sister. She's 6 years. She is clean and sober for 6 years in her own recovery. This is here in Exit Glacier. I'm based in Seward. So that's my family on the right, because I really believe it takes all of us to join the movement to really work towards that shared mission on reducing the harms of alcohol usage. And so, yeah, so I appreciate everyone for listening, and I have here any questions, as well as my email too, if anybody wanted to jot that down. At Recover Alaska, we're working on this project, but we're also working on many other projects. And if anybody's curious, has input, wants to get involved, please feel free to reach out. Thank you.
Thank you so much, Sarah. Can we do either a virtual or a real round of applause for Sarah? That's really nice to hear about your journey with your sister, and then just the excellent work that you're doing both through Recover Alaska and with Step Away. So as I've said, I always have some questions, but I really want to step back and first maybe ask Marco to present some additional information, and then open it up for everyone. Marco, please go ahead.
Yeah, thank you so much. Marco Daura here. And Sarah, thank you so much, first of all, for the opportunity that you gave us to work with you guys with Recover Alaska. Great presentation, and I don't think we could have done a better job explaining sort of our tool and how it empowers patients, consumers. Like you said, I only want to emphasize a few things. This is a tool, a self-help tool that empowers users, consumers, and I want to say patients, or because we do talk to payers, we do talk to providers, but at the end of the consumers, that they have a self-help tool, they can take a lead in managing their condition. And it's like you said, it's whether because they need to fully sort of address alcohol from a sobriety perspective, or maybe just to help them moderate their drinking habits, monitor their progress, manage their cravings, and help them meet their goals, so they can go through a flow process in the app that help them set the goals, explore additional, manage and moderate drinking, how to control these cravings, how to become active, how to share with their support group as well. So, and thank you so much again. We've taken we think we built a good efficacy data based on working with your group, but also others like the VA. We have a version that's called Stand Down that now we're piloting also with the VA. So,
Oh no, I think Marco may have accidentally disappeared, but yes, he's absolutely right. There is a veteran version, and it's really important to get that message out as well, because veterans do have specialized care needs. So I'd like to open it up. Hopefully Marco will join us again, but is there anybody else that has a question?
Jacqueline and Sarah, I don't really have a question, but I just have to say, coming to Health Thai for all this time, one of the most amazing presentations that I remember very vividly was Step Away, was when they presented it, and how impressed I was with the app. And it's just so cool to see one of the innovations things come back around in like implementation phase. And I'm just really jazzed that you did this and I got to hear it today. I mean, it's really This is really cool.
Thank
Thank
you. Thank you, Lizette, very much.
Thank you.
Um,
Lizette.
So, and I think we're getting Marco back. Marco, did you want to wrap up your thought?
Yeah, sorry guys. I don't know what happened. It get technology these days, and my camera is not working because I'm rebooting. But anyway, it's okay. So I just wanted to say that yes, to your point, Sarah. I'm not sure where I dropped off, but it empowers individuals to manage whether it's sobriety that they're seeking or moderation that they're seeking. And the the application helps them to set their goals and walk through the process, explore additional tools, control their cravings, share their successes with a support group. So a bunch of self-help tools there. And thanks to, yes, working with groups like yourself with Recover Alaska, where we have data that shows efficacy, but also working with the VA and another version of this, as I mentioned, I don't know if we caught it earlier, Stand Down, that helps them also manage these conditions. So thank you again, Sarah, for doing a great job.
Thank you, Marco. I've put the Step Away website into the chat, so hopefully
Perfect.
people can get that. So we're going to wrap up fairly quickly, but I wanted to share one thing that Sarah and I were speaking about shortly before everyone joined us. And one is that Recover Alaska and Step Away are really doing some one-on-one outreach to employers. And this would really be an awesome addition to any kind of employer program because it would provide services, and also people could be anonymous. So employers could provide the information, and then employees wouldn't have to be embarrassed or have stigma about stepping forward or requesting help. So if you'd like some more information about that, please reach out to Sarah. Sarah, thank you so much again for presenting today. This is such an example of what we can do here in Alaska. I'm especially proud of the work that Step Away and Recover Alaska have done, because it's Alaskans addressing Alaskans' problems. And we really have pulled together to try to really tackle one of the most difficult problems that exists here in Alaska. So if you know of anybody, especially in other parts of the state, places that we haven't reached today, people in Southeast or Southwest or Northwest, please reach out to us to Recover Alaska. And maybe, Sarah, you do reach across the state. Is that correct with Recover Alaska? Okay, awesome. Well, what I'd like to do is for the director's minute, I just want to say that Kim Champney's not here today on this call, but she's been an active partner with Health Tie right from the beginning. And I've been attending her Dementia Action Collaborative program for the last about 6 months. And essentially, she's taking lead on trying to provide new services for people and caregivers who struggle with dementia and Alzheimer's. And it's been a wonderful partnership. She's got so many different people and different organizations, even people providing care. And really what we're hearing is caretakers need services, they need help, they need support. And what's nice is that Health Tie has a whole series of senior and dementia type products that startups are developing. And so I've been able to provide that directly to the people who need that service the most. And I've managed to also make some connections to another member of that program, Sheila Shin, who is working directly in the Mat-Su Valley. And so it's another example of how when we come together in forums like this and we cross network, that we can really align and leverage each other's capabilities. So that's my wrap up for the Dementia Action Collaborative work. I'm happy to answer any kind of questions. Please just email me and I can tell you more about that. And with that, I'd like to give just 1 minute. I see Melanie Lucas Conwell on here today, and we also have Jake Carpenter. They are members of the Health Tie Advisory Board, but they're also leading the Alaska Angel Conference. And one of the reasons that cross-networking is so important is that we can support these new healthcare innovations by finding funding for them and helping them grow, so that then we and our loved ones can get access to these new technologies and ideas. So Melanie, if you wanted to take a minute and tell people about the Alaska Angel Conference. I know I didn't prepare you for this, but if you wanted to, you'd be more than welcome.
Thank you, Jacqueline. Appreciate it. And I won't take too long. Thankfully, I can speak about the Angel Conference at length, but I'll give some few snippets. And I see that Scott Bell, who is another one of the organizers, is also on the call. So we have some strong representation here. The Alaska Angel Conference's goal is to connect early stage startups with angel investors in the Alaskan community to actually invest in one of the companies that are presented and that pitch to the investors, and also to increase the number of angel investors in Alaska. So this is Alaskans investing in Alaskan businesses, which is very exciting. And this is the 4th year that we run this program. We have a couple of informational sessions that are coming up. We host office hours every Wednesday morning from 10 to 11. And the deadline to apply for startups and to commit as an investor is February 11th. So that's coming up around the corner. But hope to see some of you participate in this. And for companies that might not be ready for an investment, I still encourage them to participate and apply, because it is an opportunity to, first of all, network with both peers and investors, and an opportunity to practice and receive feedback on your pitch, very similar to the open innovation calls, and potentially even receive an investment if that is your goal for your company. And for angel investors or those interested in becoming an angel investor, you don't need to be an accredited investor per SEC definition, and investment units begin at $5,000. So it is a high amount, but it is a lot of value and a great opportunity to connect with Alaska's brilliant innovators and future.
Awesome.
Thank
Thank
you,
you
Jacqueline.
so much, Melanie. So, well, thank you so much, everyone, for coming today. Thank you, Sarah. Again, I wish you all well. Our next presentation will be with Ayuda on January 27th. So that's Thursday, January 27th. They are a company that provides opioid addiction treatment. They have a technology to try to help people who might be overdosing. So another important product and just initiative. So if you can, please join us then. Meanwhile, stay safe, everyone, and take care. Thank you for coming.